I am here at the MAR. I'm in the uninterrupted zone, and I'm coming here to look at Martha May's medication. First on her MAR is fluoxetine, 60 milligrams by mouth every morning. I'm going to look at what's available, and what's available is 20 milligram capsules. I'm gonna hand hygiene and put on some gloves. And I would, so I'm confirming they're 20 milligrams, she needs 60, my math is completed, and I need 3 capsules. So with gloves on, I'm going to get my 3 capsules and put them in a medication container for her to have. And I would confirm my math with the second nurse. Okay, take off some gloves, hand hygiene. Next, she has her insulin. Oh, and I checked expiration on her fluoxetine, and I'm gonna check her insulin, knowing that she needs her Lispro and her NPH. I'm looking at expiration, and I'm gonna get my insulin syringe available, clean for 10 seconds. And clean for 10 seconds. Okay, and I've confirmed it here. I'm going to confirm it a second time that this is my clear Lispro, my NPH is cloudy, and I'm going to get this at 2. No, I'm going to do my NPH. My NPH is 10. Okay. So 10. Inject. And now I'm going to put it at 2. And I'm confirming this with my second nurse as I'm going. Okay, and now I'm going to lift this up and get my 2. So hard when it's only 2. Okay, and then I would confirm with my second nurse that this is 2 units. Okay. Now I'm going to get my 10 units from my NPH, and be careful not to put my Lispro into there. And I'm gonna drop to to the 12th line. And my cloudy would have been mixed properly with rolling it between my hands. Okay, now I'm gonna do the scoop method. This is great. Okay, and confirm that it's 12 with my second nurse. And I'm going to label this with my insulin, NPH 10 units, Lispro 2 units. Put that on it. Okay, we have our insulin. Now we're going to have her ceftriaxone. And we're going to note that we need a reconstitute and our math, and with my math that I have completed, I'm going to get my sterile water, and this would be with a new alcohol pad. I'm going to clean for 10 seconds. And I'm looking at my expiration date of both vials. Okay. All right, now I'm gonna get my 3 ml syringe, and it says that I need to get 2.1 milligrams of sterile water. And if I can open this. And I'm gonna put it at 2.1. Confirm that with my second nurse. Inject that air. While it's here, I'm gonna get bubbles out. Okay, and I'm going to confirm that with my second nurse. And I'm going to insert and scoop. Or I can put my safety on. And that can go in the sharps. And I'm going to mix. Not fast, but in a good motion. And then with my math, I need to drop 1.4 milliliters, which I could still use that same needle, but I can also use another one. With my supplies, I would get another needle if I needed. Make sure that this one is still sterile and good. Drop to 1.4. Confirm with my second nurse. And I can put the safety on. And then this would go in the sharps. Okay, confirm with my second nurse, that's up to 1.4 milliliters. And I'm going to put on my 18 gauge needle. And it would be 1.5 inch length because it's needing to go into a large deep muscle, and I will choose the ventral gluteal. Okay, we're gonna label this for ceftriaxone. (200 microkilograms). Okay, now we're going to look at her cyanocobalamin, which is her vitamin B12. And I'm looking at it, confirming expiration. Now I'm gonna grab it and look at it and confirm that it's her sancomycin. Oh, sorry. Her ceftriaxone is 0.5 grams. 0.5 grams. Her cyclopamine is 200 micrograms. And with the math and looking at what's available, looking at expiration, doing this 2 times before preparing the medication, I'm needing to drop 0.2 milliliters. So I will clean for 10 seconds. And I checked expiration. Okay. I'm gonna get a 3 ml syringe and a needle to drop up. Okay. I'm needing 0.2. Confirm that with the nurse. There's this weird bubble at the top. Trying to make it go away. Okay. Confirm that with my second nurse. And I can get bubble still out. And confirm with my nurse. I'm only doing this because I want to save my stuff. And this would go in the sharps. And put on a new needle. Okay. And this is my cyanocobalamin 200 micrograms. Okay. Now I am needing my tuberculin there. Okay. And I would clean with a new alcohol pad, 10 seconds. But before I do that, I'm confirming that it's the tuberculin before I get it out. Now that I have it out, I'm checking it again, expiration, and now cleaning it for 10 seconds. Okay, garbage. And I'm going to have it drawn up, which it is. I had it there at 0.1, confirming that with my second nurse. Inserting the air, draw up. And confirming with my second nurse. And going to do the scoop method. Okay. And having this labeled. and that is 0.1 milliliters needed for that. So I have my 4 syringes, my capsules. Each time I'm looking at the medication before I get it. The second time when I am pull it out, I'm looking at the expiration, I'm confirming with my second nurse, and I've checked my math and as well as the second nurse. And now I'm gonna go to my patient.